They don't treat me like I'm not in the room. They actually talk to me and make me feel like this is actual team effort.
Really good for a medical student. It really helps you evolve into a physician a lot sooner.
Let them know exactly what's going on so that they can treat you to the best of their abilities.
Everyone is a key player in deciding what happens, what the next steps are, how we can achieve the best outcomes for patients. And I think that patients are able to really feel like a big part of that.
I think we do need to do better transitions of care, and part of that means getting everybody that's involved in the patient on the same page. SIBR is an acronym for Structured Interdisciplinary Bedside Rounding, the results of which have shown decreased length of stay, decreased cost, decreased hospital-acquired complications, and increased patient engagement and patient satisfaction. It's very structured in that there's a set time where we begin, and the patient is giving one story one time, as opposed to relating a story multiple times where there could be inconsistencies. It also gives you an opportunity, because you have a script that you're running through, to make sure you're hitting everything you need to do. We're synchronizing all of our thinking and all of our planning at once. We don't have to talk through the entire plan at that time, but we can set an agenda. SIBR is actually just a part of what we would call an accountability care unit, which is essentially what we're trying to create, where not only do you have the bedside rounding, but you have the geography of everybody working on the same unit.
The nurses, they actually pre-round on the patients that are going to participate in SIBR, making sure that their care is all wrapped up so that they can physically and mentally be involved in that conversation. They identify the team members that's going to be part of the SIBR rounds, informing them that it can be multiple people at the bedside at this given time. The nurses ask the patients prompting questions. This triggers the patient and family to have that aha moment and say, oh yeah, I do have questions about this. And then the nurse will write those questions on the whiteboard, and then it will get readdressed in SIBR rounds. One goal is discharge planning and making sure the patient or family has the resources needed to have a safe discharge. The patient satisfaction and the family satisfaction has been phenomenal.
SIBR is basically an innovative way of accomplishing our daily work that is very patient-centered and encourages interprofessional collaboration and teamwork. The entire care team is present at one time and stands at the bedside coming up with a plan with the patient and their family involved. There are a couple things that you'll notice happen in every single SIBR rounds, regardless of the team. Every session starts out with the nurse presenting the patient's primary concern for the day and other questions that they'd like to have answered during rounds. That gives the team a chance to craft a care plan for the day using the patient's values and goals. Every single member of the team introduces themselves by their name and their role. They make sure that they're addressing their updates directly to the patient and the family in language that they understand. And you'll also hear a standard quality and safety checklist that we've embedded to cover those very important can't-miss items in their care for the day. So at the end of each SIBR session, you'll hear a wrap-up where the team says, okay, these are our steps for the day, here's who owns it, and let's make sure that we've really addressed every single patient question and concern. It gives us a chance as a team to really recognize that this is a human being that we're treating. They really see that this is an effort from their team to partner with them in their healthcare. When patients are more satisfied with the way their team has communicated with them and taken their values into account, they're more likely to be compliant with their care. Better communication and teamwork and patient engagement actually leads to better patient outcomes.
Having the SIBR structure in place allows everyone to be at the same place at the same time. You're able to observe the learners in a much more realistic, holistic environment where they're actually delivering patient care. You can assess medical knowledge, you can assess professionalism, you can assess patient-centeredness, and you can assess multiple learners at the same time. And it also allows you to see how they interact with the other staff members, and it allows the patients to actually communicate with the whole team at once what they need and see how the learners are going to respond to those needs and address those concerns. It enhances accountability of the team. It really kind of puts everyone back into the frame of mind of, oh, there's a person here. It's not just a chart I have to fill out or a note I have to write. It's, I have a patient that I need to take care of, and we're all working together. And it's kind of, I think, nice for the patient too, because I don't think they always realize how many people they have working on their situation behind the scenes.
SIBR rounding brings rounding where it should be, to the bedside, and puts the patient literally in the center of the team that's taking care of them. They get to participate on eye level with every single person on their team every day. We always, when I'm rounding, raise the bed up so that we're all sitting there looking at each other in that same plane, having that conversation. And that makes it a collaborative care plan. It's not about walking in and giving a report. It's about developing a relationship across the team with the patient in the middle. So it's important to have a great environment in the room, and that allows that patient to feel more comfortable asking questions. So it does put a face on the team, but also for the team, we're not just talking about Mr. X down the hallway. We're in that room, and it puts a face on Mr. X. We get to clearly communicate what the patient's goals are, what the team's goals are. We're learning how to interact with people better because we're doing this. I love patients, I love people, and I love our team.
We learned about the theory of an interdisciplinary approach to medicine in the preclinical years, and it was great to see that in action.
But after they give their reports, then you often do have questions, and then you have everybody there on the spot.
Hearing my patient interact with some of the other healthcare providers on the team really made me more in tune with my patient's needs or what their preferences were in terms of their care.
It makes me feel comfortable knowing that there's more than one person, because more than one person knows different things, so when they get together, it works.